After my last video about life after gallbladder surgery, I received quite a few comments asking whether it's better to have the surgery or try to avoid it. I completely understand that question because it's one we wrestled with ourselves. The decision to remove my husband's gallbladder wasn't something we took lightly. We spent a lot of time weighing the risks and benefits, asking questions, reviewing the test results, and carefully considering other options. What made the decision especially difficult was that the time wasn't really on our side. After his last gallbladder attack, we knew another attack could happen at any time, and we had no way of knowing whether the next one would be even more serious. So in this video, I want to walk you through everything that led up to that decision, what happened, what we learned, and the factors that influenced our choice. My goal isn't to tell you what decision you should make. Every situation is different, and every person's medical history is unique. I simply want to share how we arrived at our decision. Because to understand why we chose surgery, we have to go back to where it all started. It started with what we thought was just indigestion. My husband had experienced this kind of stomach pain for years, long before we realized it might be connected to his gallbladder. Sometimes the pain would last most of the night. He would take some Tylenol, try to sleep, and usually by the next morning, the pain was gone. Now, because it typically went away, it was kind of easy to brush it off. But over time though, we started noticing a pattern. The pain often happened after a heavy meal, especially meals that included a lot of meat or fast foods. So whenever he had an attack, we would become much more careful with his diet for the next several weeks. He would eat lighter meals and avoid those fatty foods. And then usually we won't notice the pain for months. Now, also one of the other things we noticed, that wine also seemed to be a trigger. It would worsen his stomach pain, and it often aggravated his gout at the same time. So dual pain area. For several years, we felt like we were managing it. We thought that as long as he watched what he ate, avoided certain foods, and rested whenever the pain returned, we would keep things under control. And for a while, that seemed to work. Actually, for many years. But with anything health-related, it eventually stopped working. Some of you may be wondering why he didn't go to the hospital earlier. I'm a nurse, and why wouldn't he be going to the hospital? The honest answer is that he didn't want to. I suggested more than once that he should have it checked out. But because the pain usually disappeared by morning, he felt that he could tolerate it and move on. And I think this is probably something many families can relate to. When a symptom comes and goes, especially on its own, it's very easy to convince yourself that it isn't urgent. After we had been living in Thailand for almost 2 years, the pattern started to change. At the beginning of last year, the attacks became more frequent. Instead of happening every month or so, they began happening every few weeks. At the same time last year, they were happening almost every week. And I made a point that he needed to see a doctor, and he eventually agreed. And so I was going to make an appointment for later that week. But before I had a chance, he had another attack. And by this time, he was getting a bit concerned. And on top of it, this was one of the worst pain levels than the previous one. And it lasted longer. The next morning, I went into his office to check on him and noticed something that was wrong and something familiar that I've seen in the hospital. The whites of his eyes looked yellow. His skin also had this kind of yellow greenish tint. As a nurse, that immediately concerned me because I knew he was jaundice. Jaundice happens when bilirubin builds up in the body. it can be related to problem with the liver. That's what I was afraid of. It could also be the gallbladder or the flow of bile. And it isn't something that you should ignore. I cover his jaundice and liver test results in more detail in another video. I'll include that link in the description, as well as the link of that video at the end of this video. That day, I took him to a university-affiliated hospital here in Thailand. I chose that hospital because, based on my experience, hospitals connected to universities often have access to more specialists and diagnostic resources because they're considered a teaching hospital. So we arrived on that Sunday afternoon. The emergency department was busy, but honestly, it wasn't any more crowded than many emergency departments I had seen in the United States. We waited a couple of hours before he was seen and had blood work ordered. Then we waited another couple of hours for the results. By that time, his pain had already subsided. Pain level 0 out of 10. The most noticeable symptom was still the greenish yellow tinge on his skin. When the blood test came back, several of his liver enzymes were elevated into the 200s and some were close to or above 300. At first, we had wondered whether he might have kidney stones or gallstones, but the jaundice and elevated liver test made gallstones much more likely. The first doctor performed an ultrasound in the ER, but he said the results were inconclusive. Gallstones were suspected, but they couldn't confirm exactly what was happening. So this doctor ordered more blood tests, including testing for hepatitis C, as well as a CT scan. By this time, unfortunately, we spoke to the next doctor. We had already been waiting for more than 5 hours. The original doctor had gone home and it was getting close to 7 in the evening. So we were getting kind of tired. I really wanted him to have the CT scan that day so we could get a clear answer, but no one could tell us how much longer the wait would be. Now, I want to point out that when you go to an emergency department in a hospital, one of the things that happens is that they may get busy with other patients that require immediate CT. So if you're a patient that has no life-threatening symptoms, you might have to wait longer. But I got a sense that from this hospital, they really didn't know when the next CT was going to happen. Because it was a public hospital too, we understood that the wait could be longer than it would be at a private hospital. We decided to then go home and return first thing the next morning. And that's what they also suggested as well. So following morning, we arrived around 8 o'clock, registered again, and waited to see another doctor. That doctor also agreed that he needed a CT scan to determine whether there were stones in his gallbladder or, more importantly, his bile duct. But then we were told that the earliest available CT appointment was 1 week away. I wasn't comfortable waiting a week. He had already experienced jaundice. His liver tests were significantly elevated, and we still didn't know whether a stone was blocking flow of the bile. But given that he had no pain, it was most unlikely. I asked whether there was any way to get the scan sooner. We were referred to a private hospital affiliated with the same university. That day, he was able to have the CT scan. We paid about 5,000 baht out of our pocket, which is equivalent to about $150. The CT confirmed that he had gallstones, but then had to meet with a specialist to review the results. And the earliest appointment available was 3 days later. So we waited and we met with the specialist. And he explained that there were stones in the gallbladder, but the CT scan didn't show exactly how many stones there were, whether any had moved into the bile duct. We're kind of back to the same base point when we went to the ER. He recommended another procedure called endoscopic ultrasound. During that procedure, a scope would be passed through the mouth so the doctors could look more closely at the bile duct and surrounding area. If they found a stone in the bile duct, it might be possible to remove it during a related procedure. Depending on what they found, my husband might still need his gallbladder removed afterward. The problem was that the specialist who performed the procedure was only available once a week. That meant waiting more than another week. And at that point, I was beginning to believe that his gallbladder would probably need to be removed. And I understood my husband was also getting frustrated. My husband was willing to wait, but I wasn't completely comfortable with that plan. I've just had too many patients I took care of in the emergency room with this gallbladder problem, and patients who've had their gallbladder removed. I kept on wondering whether it made sense to put him through another invasive procedure, especially if there was still a strong possibility that he would need surgery anyway. So I started doing more research and looked at other hospitals. We decided to get a second opinion at Bangkok Hospital, which is a well-known private hospital in Thailand and is used to caring for international patients. We made an appointment that same week with a surgeon who specialized in gallbladder surgery. I'll call him Dr. A. Dr. A reviewed the previous results and ordered another abdominal scan, CT scan, with contrast the same day. We waited at the hospital, and later that day, he showed us the images. He looked at the screen. My husband mostly looked away because he doesn't do particularly well with blood, needles, or medical images. On the scan, I could clearly see his gallbladder contained a large number of stones. I asked the surgeon whether it was possible to remove only the stones and leave the gallbladder in place. I'm like most people. I rather keep everything intact in my body or in my loved one's body, and I don't want to remove anything that's needed when you don't have to. So we weighed the benefits, and the disadvantage of keeping that gallbladder is that he had so many stones that it was inevitable that he was going to release another stone, go through his pain, and there might be some situations where the stone that is going through the bile duct may scratch the gallbladder and cause a lot of pain, and there may be some bleeding on top of that. He explained that there were too many stones and that removing only the stones would not solve the underlying problem. There was also a good chance that more stones would form and he would have this problem throughout his life. So at this point, the decision became much more clear. I asked the surgeon a lot of questions, though, to make sure that this was the right decision. And the questions I asked were, well, how many gallbladder surgeries had he specifically performed? What was the recovery time? Would my husband need any additional medications after surgery? And what would happen to the bile once the gallbladder was removed? The surgeon explained that the liver would continue producing bile like always. The gallbladder's job is to mainly to store and concentrate the bile. Once the gallbladder is removed, bile continues to flow from the liver into the small intestine. But instead of being stored and released in larger amounts during meals, it would flow more continuously. He also, Dr. A, explained that most people do not need long-term medication after gallbladder removal. After reviewing the scan and discussing the risks and benefits, we decided to move forward with laparoscopic gallbladder removal. He stayed in the hospital for 2 nights. The procedure itself is minimally invasive. They make incisions in his abdomen 3 points, the larger one being below actually it was above his belly button, or is it below? Let me find out. I forgot. Okay, I just checked. I've been looking at his incisions for a while now, and I just completely forgot where it was. So far, his incision, the bigger one, is down below his belly button. And that has some scarring and a little bit of scarring in the other 2 incisions. That's in the upper area of the stomach. So far, everything post-surgery was fine. He stayed in the hospital for 2 nights, and that was pre-planned, and that's what the hospital suggested. Having cared for patients with gallbladder disease during my nursing career, I knew that repeated gallbladder attacks were not the only concern. A stone can move out of the gallbladder and become trapped in the bile duct. That can lead to jaundice, infection, pancreatitis, or other complications. And that's what we wanted to avoid. In my husband's case, he had already experienced repeated attacks, increasing pain, the jaundice, and elevated liver enzymes. I want to emphasize that no surgery is completely without risk. But based on everything we knew at that point, leaving the gallbladder in place felt like a greater risk. His symptoms were getting worse, and the risk of waiting were becoming harder to ignore. That was how we ultimately made the decision. Not because surgery was an easy choice. By all means, it was not. But because after years of trying to manage the problem, his symptoms were getting worse, and the risks of waiting were becoming harder to ignore. Of course, every situation is different, and this is only our experience. I really like to hear from you, though. Are you currently deciding whether to have a gallbladder surgery? And have you been able to wait and change your diet or move forward with surgery? And what part of the decision feels most difficult for you? Let me know in the comments, because your questions may help shape the next video. I'm also thinking about making a follow-up video on what we wish we had known before surgery, the questions we asked the surgeon, and what recovery was actually like during the first few weeks. Honestly, it was kind of scary for us. So tell me which of those would be most helpful to you. And if you're going through this decision right now, I hope our story helps you feel a little more informed and a little less alone. I'll see you in the next video. Thank you for watching.